recording. Okay.
Hello, everyone. Thank you so much for helping in. It's another amazing session for you. If you're a returning subscriber, thank you so much for helping in. If you're new here, my name is Ryan Simonyema, fourth year radiography student based in Nigeria, and I'm also a part of my studies. I'm also a medical content writer, and today I have an amazing guest speaker. Hey, Michelle, could you introduce yourself to the audience?
Yeah. Hi, everyone. My name is Michelle. I am a first year PA student, and I'm very excited to tell you about my journey today.
Amazing. So we have a couple of questions for you to answer, Michelle. You ready?
Yes.
All right. So tell us a bit about your school and about your PA school before we move further.
Yeah. So I am currently, like I said, a first year PA student at Mercer University that's located in Atlanta, Georgia. So PA school, for me, it's about a 28-month commitment. So that's about 2 years. And it is a grad school program where you get your master's degree in medical science. And then you get to work in collaboration with a physician after you graduate as a provider. So I've been going through my first semester. I'm about to finish in next week on Wednesday. I'll be done with my first semester of PA school. So that's been feeling pretty surreal. And um, yeah, it is been like they say, it's like drinking water from a fire hydrant, a lot of work, but it's definitely you're capable to do it if you study and put in the work too.
Absolutely. So that draws me to the first question. All right. So you ready?
Yes.
All right. So can you share your journey thus far? To becoming a PA, med student, and what inspired you to pursue this career path? So what made you to choose this path? Tell
Yeah.
us.
So I went to undergrad as a pre-med major, actually. And during that time, I was taking classes. And then, first of all, it was kind of like the time commitment for me because for med school, it's very rewarding, but it does take a lot of time. You have 4 years undergrad, then 4 years of med school, and then you have residency and fellowship depending on if you specialize. And then, although I'm very interested in medicine, I just thought that the timeline for being a PA really aligned with my goals, like when I wanted to practice, at the age that I wanted to practice, financially, what I wanted to achieve as well. And so I really also enjoyed the lateral mobility that a PA like the profession has to offer. And what lateral mobility means is you can move through different specialties without having to go back and recertify. So if, for example, I worked in OBGYN and then I wanted to suddenly do some emergency medicine work, it's not like I would have to go back, get recertified. I could just apply and begin working in the specialty. So that's how I started to hear about it. I did a lot of research, and the classes that I was taking already for med school, they also fit into my PA school prerequisites. So I decided to change over. Um, and I got my volunteer hours, my clinical hours during my undergrad time, and then I applied in my senior year.
I want to get something straight. Were you born in the United States of America?
Yes.
But you have an Asian background, right?
Yes, correct. I have a Malaysian Chinese background, so I'm a first generation student. So my parents, they're from Malaysia, and then I was born in the United States.
Okay, cool. So, before I move to the second question, how does your background affect you as a PMS student?
Yeah, that's actually a great question. I love that question. So I think that my background, actually, no one in my family is in medicine. My parents, they are more in like the restaurant business. So growing up, I think I actually wrote about this in my essay for PA school, but being a first generation student, and honestly any student that kind of goes to school like first and setting like the record for your family, I think you have, it is like a little bit of pressure, but I feel like you see how your parents work. You kind of have to be like the transcriber when you're younger, when you go to doctors' offices, like with their healthcare literacy, like what different things mean, like they're trying to understand things left and right. And then, even when you're young, like you have to pick that up. You have to be able to explain like their healthcare, their insurances, like this and that. And so I think that definitely pushed me a little bit towards medicine, just because I wanted people like my parents to have healthcare access the way that they did, without having like too many language barriers, without having any stigma against them. Because sometimes you can go into an office and then it's like people will just spill medical jargon on a patient, and then they're like, I don't even know what that means. I have no idea what hypertension means. I have no idea what diabetes is. And then you have to go back and then look it up on your own. But it's lucky when people have like someone that can be there for them, someone that is willing to spend the time to sit down, explain things in a way that anyone could understand, even if your English is not your first language. So that definitely drove me towards going into medicine in general, just being a healthcare provider that would be able to provide adequate healthcare for any population, whether it be immigrants or it be people in different socioeconomic backgrounds.
Wow, I love the fact that your background doesn't really matter in terms of PA school. So thank you so much. And I think that that's the reason that it made you like get into the PA school, because your story really inclined towards what you're about to do, and you're setting a record in your family, which they're really proud of you. So congratulations to you, by the way.
Thank you. I appreciate that.
Yeah. So the second question goes this way. So what are some of the key differences between PA education and medical school? There are some intricacies in terms of what really a physician advocate does or do. So tell us, what's the difference between a PA school and a medical school?
Yeah. So, PA school, the way it goes is the timeline is, so you go to undergrad for 4 years and then you apply, and you apply on this platform called CASPA. CASPA is kind of like the overall application when you kind of send that one application to a bunch of different schools. And I think med school has something similar to that too. After that, you get in, you interview like you would for any program, and then actual PA school is about 2 years long. For me, it's 27, 28 months, so about 2 years, 4 months. And then after that, you just start practicing. So you can specialize. I know now some people can go into fellowship. You can go into teaching as well. But you don't, fellowship isn't as long as, and there is no residency part. So for med school, the difference is you have to take the MCAT first. For me, I took the GRE exam, and then I took also the Casper exam, which kind of tests like what you would do in different situations. I think med school, you also take Casper. So application wise, you have a standardized test and then the Casper exam, but the standardized testing is completely different. The GRE, it's it's less hours. I know the MCAT is about like 8 hours long. It's like a full day commitment. People like study for that for months ahead of time. For me, I studied for the GRE. I think I started 3 months ahead of time and then I took it. And then that just kind of gives you like the benchmark. As for classes in undergrad, the classes were pretty similar. It depends on what school you go to, or the schools that you're applying to. And a major difference between med school and PA school is what they require in terms of clinical hours. So med school, they require you to focus more on like, you need to have research background, maybe some clinical help work here and there. Volunteer hours are important. And then I know research was big though, like having research under your belt. And then for PA school, clinical hours were like the main thing that you had to have. So you have to For me, I had about 3,500 clinical hours by the time I applied. Most schools now, it depends, you would have to do your research, but I think it's between 1,000 to the upper end of the spectrum is about 2,000 hours. Um, and so I got my healthcare experience through working at an OBGYN clinic and then also a derm clinic and also at a nursing home. And so after my clinical hours, I got some volunteer hours and then I applied. So I think the timing is a little different as well. Med school's 4 years, PA school's about 2.5, and then med school after that you have residency and fellowship. So that was a long answer, but that's the main difference.
And so, what does a physician advocate do in
Yeah,
general?
so a physician assistant slash physician associate now, they work in collaboration with a doctor, an MD. And so they are able to prescribe, treat, diagnose patients just as any provider would be able to do. Um, I think the main difference is you can't have like your own practice. So you can't start like your own like business in terms of like a specialty office. But yeah, and I think that is really great to do as well because you can lead your own work, but you can also always have the comfort of knowing that there's someone else behind you. Like there is going to be a specialist behind you. If you specialize in like cardiology, there will be a cardiologist with you as well.
Amazing. Thank you so much for dispatching the disparities in what a physician advocate does. Thank you so much for
Mhm.
sharing that with us. So the third question goes this way. So as a first year PS student, what clinical experience have been most impactful for you thus far? Tell us.
Yeah. So actually, my first year, it's all didactic. So that means that we're in a classroom every day, like 5 days a week. So there hasn't been that much clinical experience for me this year. Next year, we go on rotations. So that means we're going through like OBGYN, emergency, oncology, whatever you like, or orthopedics. But I will say, prior to my first year, so like I was saying, I worked at an OBGYN clinic and then I also worked in a derm clinic. And one of my most impactful experiences there was probably from my OBGYN clinic. I worked with a lady and she had been she had recently come to the States and she came in with like burn marks everywhere. She had a quite a wild backstory to her. And she basically had to flee. I think she was from Pakistan. Like she had to flee from there and she ended up here. She didn't really have medical insurance and she was on her third trimester of pregnancy. And so it was kind of getting through that, being able to communicate and um, get past the cultural barriers and just letting someone know that you're there for them and, seeing how they grow through every checkup and then finally seeing their baby come into this world. I think that was extremely impactful. Being able to see like, even though you're from a completely different culture and it may be so hard and people are coming in from completely different backgrounds, being able to have a common goal for, in this case, it was just delivering a healthy baby for her and making sure that she was okay, that she had transportation, that she knew what was going on, and that she understood the healthcare jargon behind, our Western culture and Western medicine. I think that was really impactful for me to see how different providers would handle that, how I should handle that as a medical assistant.
Amazing, amazing, amazing. Did I hear it correctly? Did you work as a medical assistant?
Mm-hmm. That's how I got my
Amazing,
patient care hours.
amazing, amazing. So, you had a prior experience before moving into PA school. That's cool.
Yes. Mm-hmm.
Hmm. So, how do you balance the demands of your PA programs, with other commitments of your interests? So, how do you strike a balancing system for them in a nutshell?
Mm-hmm. That's so funny. This first year, like I said, it's been so much work. And I feel like I actually haven't had as much time as I would like to do like things that I love outside of school. I try to set aside time to do things I like, to kind of get away from studying all the time. And so for me, that kind of looks like watching my favorite shows here and there. Like I really like to come home, like relax a little bit before I study, because right now PA school it's 8 to 5 most days, Monday through Friday. And so when you come home, you have to study because you probably have at least 2 to 3 exams a week. And so there's not a lot of time, but I think just knowing that it's okay, like you you need to pass and you need to do your best, but it's okay if you have time to just like, go on a run, go to the gym and go eat dinner with your family or with your significant other. I think just giving yourself less pressure to, honestly, just, your life is not school. Like school is there for you to get to your next goal, but that should not be your life. And I think I'm a pretty firm advocate of that. Like you, whether you're in med school or whether you're in PA school, nursing school, always make time for yourself, because I think if not, you're going to burn out and it's just going to catch up to you really quick.
Wow, 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 wow. Because of time, I think we've come to the end of the session because the question I'm going to ask about you is you've 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 threw some insights about that. You know the challenges you talked about the challenges you faced during your peer and how you've overcame them. Have you talked about it?
My challenges becoming a PA student.
Yeah, the challenges you faced and you know how you
Yeah, yeah.
overcoming.
Yeah, I'd love to share that. I think the biggest challenge that a lot of students run into, especially because a lot of even med students, nursing students, PA students, you're pretty young, like when you enter school, And so a lot of times when you're working before that, like for me working as a medical assistant, you're always going to run into people that think you can't do it, that think that they can tell you what to do, that people would put obstacles in front of you for sometimes no reason at all, and you just have to climb over it. So a specific example for me was, I think this was when I was a sophomore or junior year in college. So I was about 19, 20-ish years old, and I got my MA license, and I was working at this clinic. And the manager there, like, she was just telling me like, oh, these hours that I'm working here are not going to count, like this is not going to count. Or at my next office they would be like, I'm a back office medical assistant, and for a PA school it's very important you get your clinical hands-on experience. So that doesn't mean sitting at the front desk, that doesn't mean like, filing papers away in the back or being, cleanup duty or whatever. That means you're in the room with a provider or taking the blood pressure, drawing the blood, doing the work that you need to do to apply. And people will just think sometimes that you're young, you don't know enough, like other people have had more experience. And to me, I think you should never let that get to your head. Always know that you've done your work, you know what you know, and you should be confident about that no matter your age. Even if you are a little older and people think that you don't know what you're doing, like yes you do. Like everyone knows what they're doing, and you know your goals, and that's why you shouldn't let anyone throw unnecessary barriers at you.
Yeah. So
Ransom?
thank you so much. I appreciate you for helping and sharing your own narratives on this question. So thank you everyone for joining. Thank you, Michio.
Thank you. Thank you.
Bye.
Bye.